A big medical breakthrough in the fight against coronavirus has identified a drug that could have saved thousands of lives had it been used from an early stage in the pandemic. The research, led by a team of scientists at Oxford University, shows that dexamethasone, a familiar steroid that's been in use for 60 years, can be remarkably effective. The findings are based on trials involving some 6,000 patients across the UK. The drug cuts the risk of death by a third for patients on ventilators and by a fifth for those requiring oxygen. Our medical correspondent Fergus Walsh has the story.
For those laid low by COVID-19, for the very sickest hospital patients, at last, a drug that can tip the odds in their favour. 6,000 NHS COVID patients were part of the trial, and the results were so overwhelmingly positive they were rushed out days after the study was completed. It found that dexamethasone saves one life for every 8 patients on a ventilator, and one life saved for every 25 patients on oxygen. If it had been used from the outset of the pandemic, it's thought it could have saved 4,000 to 5,000 lives in the UK. Catherine Milbank from Buckinghamshire spent 12 days on a ventilator with COVID-19. She received dexamethasone after her husband Paul gave consent over the phone for her to take part in the trial.
When someone tells you that your wife's right hanging on the edge of something that could go either way, and you know that there's current proven drugs that are already in the medical industry already that are prescribed to people, when you know that they are around and there's a chance that might help, you grab it.
Without trying these things, we're not the researchers, us, no one's going to get anywhere in finding out the right drugs to help the pandemic that's happening and still going on. As we're coming through it, but I'm just eternally grateful and will be for the rest of my life.
Dexamethasone has been around for decades. A steroid, it's widely used for arthritis, asthma and other conditions. This is a genuine breakthrough in the treatment of COVID-19. Dexamethasone, either in tablet or injectable form, is available in every hospital pharmacy. The treatment costs around £5 on the NHS and will be even cheaper in developing countries. So this drug has the potential to save lives across the world.
We've been on a huge search for treatments that actually will improve survival for patients with COVID. This is the first drug. Not only is this the first drug that's improved survival, but it's available worldwide immediately and is affordable. That's fantastic news for patients.
The drug helps stop the immune system from overreacting to COVID. It's not a cure, but it will help more of the sickest patients to overcome this disease. Fergus Walsh, BBC News.
Well, the latest figures from the Department of Health show that in the past 24-hour period, 233 more deaths linked to coronavirus were recorded, and that brings the total to just under 42,000 across the UK. And that includes hospitals and care homes and the wider community. The graph of COVID-19 deaths since the middle of March shows that downward trend, with the current 7-day average at 155. So let's talk to our medical correspondent Fergus Walsh, whose report we saw there on this new treatment. Well, I say new treatment, it's a familiar drug, Fergus, isn't it? I'm just wondering, given how familiar doctors are with it, what is its potential now?
I think this is really significant, Huw, and really wonderful news. This drug cuts the risk of death in the sickest patients on ventilators by a third. That's massive. Now, it needed a huge trial, 6,000 coronavirus hospital patients, for those benefits to emerge. And that all happened here in the UK. 175 hospitals were involved. And it's one of the strengths of having a cohesive national health service. Now, it's frankly a bit of a surprise that the first drug proven to save lives with COVID-19 is not some shiny, high-tech experimental treatment that would cost thousands and only be available in rich countries. It's an old, cheap as chips steroid that's used all over the world. Some caveats: it doesn't stop people getting coronavirus, it doesn't help early on in the disease, it's only for the sicker patients. But wow, for them it is progress, and from now on, every hospital patient with coronavirus on oxygen or on a ventilator will be offered dexamethasone. So for them and their families, that offers real hope.
Fergus, many thanks once again. Fergus Walsh, our medical correspondent.